Thank you, Dr. Foti, and members of the AACR. It's an honor to receive this Distinguished Public Service Award for exceptional leadership in cancer science policy, an honor that I share with you and the association for its long history of distinguished public service to current and future generations of cancer researchers and healthcare professionals, patients, caregivers, and advocates, as well as policymakers, government agencies, and elected officials. I wish to express my gratitude for AACR's commitment to the next generation of cancer researchers and medical professionals. I was once part of that next generation, having been a student in the very first AACR ASCO workshop on methods in clinical cancer research. The year was 1996, the same year I attended my first AACR meeting. I went at the urging of my mentor, Tom Fry, then at the Dana-Farber Cancer Institute. At that first meeting, I met my friend and colleague Paul Calabrese, who took me around the meeting and to visit the White House. Since that time, I've attended every AACR meeting in person, except, of course, this year. Some years later, I was invited back as one of the first 4 trainees from the AACR ASCO course who later became faculty. I've had the privilege of serving on the faculty for that course 8 times. It is always wonderful to meet fellows whom I have trained there and to see them doing so well. In 1997, I took a position at MD Anderson Cancer Center in Houston. There it was under the wing of my late mentor Wan Ki Hong that the importance of giving back took root. Working with societies and organizations such as the AACR to help train young students and fellows and to work on policy, because policy is such an important part of what we do. It is critical to bring our science to the community to prevent cancer and to find the best treatments for patients. So, I share the honor of distinguished public service with the AACR. They have provided one of the significant platforms from which we have, served patients, as well as policymakers, government agencies, and elected officials. We know that the best way to treat cancer is to prevent it, and tobacco control is vital to do this. We also know the dangers of electronic cigarettes and the impact of vaping on our youth, especially minority populations. It has been an honor to serve as chair of the AACR Tobacco Products and Cancer Subcommittee since its inception in 2009. I'll continue efforts to educate the public on the dangers of smoking and now vaping, and to provide policymakers with the best science and data-driven tools to make tough choices in face of market pressures. The experience has been incredible. For 11 years as a medical oncologist, I've worked with the best people in addiction research, epidemiology, communications, and government, and we've done so many wonderful things to try to cease tobacco use. There are so many people to thank from the committee and all the events we've done. The congressional briefings, Surgeon General briefings, Capitol Hill briefings, numerous different policy statements, many of which we are showing you a little bit later in my talk. It has been an extraordinary experience to work with the AACR Office of Science Policy and Government Affairs. In addition, I wish to thank the AACR for their service in providing a platform for which I and my colleagues have presented and reported on new treatment data, as well as for their advocacy efforts with the FDA, the NCI, and other agencies on behalf of cancer researchers and ultimately our patients. These are efforts which I have been so intensely involved in as a member of the Science Policy and Government Affairs Committee and its Regulatory and Policy Subcommittee. My research has focused on new drug development and advancing personalized medicine, clinical trial design, and immunotherapy. One time that stands out for me was when we presented our battle data, Ed Kim, in 2010 with Ignacio Estuba, Jack Lee, Scott Littman, and Wan Ki Hong at the AACR annual meeting as a plenary talk. Battle was a paradigm-shifting trial that really defined new input and new ways of regulatory science for drug development. I was so honored our team was able to share those findings with the community through the AACR. Other notable associations that have allowed me to better serve the community include my membership with the National Cancer Policy Forum. In 2008, I co-chaired the Personalized Medicine Workshop Planning Committee. Out of this came the clinical trials report that resulted in the reorganization of the NCI Clinical Trials Program. I've served on committees for many years related to precision medicine, immunotherapy, and immune-guided therapy. Through this, I met Ellen Siegel and became involved with the Friends of Cancer Research in 2012, and we continue to work together today. We formed a committee to develop the Lung Cancer Master Protocol, a public-private partnership that is a collaboration between the Friends of Cancer Research, the FDA, the Foundation for the NIH, the NCI and its cooperative groups, and multiple companies. The idea is to bring novel drugs to more patients. I'm thrilled to have been a co-principal investigator and now the principal investigator for the SWOG Lung Master Protocol and a member of the Steering Committee and Drug Selection Committee for this protocol since 2014. 2,000 patients across the nation, 20% of whom are minorities, have received targeted biomarker-based therapies through this innovative precision medicine tool. Truly, the success of this protocol is a historic event. Along the way, we've seen precision medicine evolve, and it has been great to be involved in the regulatory science and to be able to work in many different areas. It is such an honor to receive this award today with the 3 other winners, and I look forward to sharing more about the work I've mentioned in my lecture. I just want to make it clear that this has been a true effort among so many people, and it's just so wonderful to be part of it. I must thank my family, my wife Karen and daughter Hannah, for the continual support. Also, I must acknowledge the amazing support I receive from my team, members of the Yale Spore and Lung Cancer at Yale Cancer Center, my staff, Philip Grover and Lisa DiCello, and our core administrative team, Ed Kaftin, Yang Zhou, and Mina Wang. Thank you, and thank you AACR for your continued support of researchers, medical professionals, patients, and the public through your education and training, advocacy and outreach, funding, and support.